So Buju Indinwe Manidug, Babiwash Indigenous Cause Mukwandode Mushkaziving and Donjaba. My name is Philomena Kebec. I'm a Bloomberg Fellow with the Bad River Band of Lake Superior, Chippewa, and I'm here with my very good friend, Clinton Alexander, who is the Behavioral Health Director at the White Earth Nation. You're going to introduce yourself too.
Buju Minigijiga Makwami Bisa Indigenous Cause Mainga and Dodeum Gawa Babiganika Gandunjaba. I share that my name is, in our traditional way of saying, I was given the name Brings Hail. I am of the Wolf Clan, and I'm an enrolled member of the White Earth Band of Chippewa Indians.
So, Clinton, can you just give us some context? Where is White Earth?
So White Earth is a 60 by 60 reservation, 60 miles by 60 miles reservation in north central Minnesota. We're a few miles from the North Dakota border and about an hour and a half from the Canadian border in Minnesota. We are one of 7 bands that make up the Minnesota Chippewa tribe. We are the largest band with just shy of 17,000 members right now. There are 11 tribes in the state of Minnesota.
So, you know, while we were outside, you were talking about the population trends that you're seeing in White Earth. Can you just share that?
Absolutely. I think, you know, the fight that we're talking about right now in terms of overdose and the loss of life that we have seen in the last decade and the continued, you know, I mean, it's almost a straight up shot right now in our race rate disparities that are occurring. What we're seeing is Minnesota tribes have seen this for a while. Our membership numbers continue to decline, and right now our death rates continue to outpace birth rates. So just in the last 5-6 years, we've seen that number drop from 18,000 down to 16,000. During COVID, we saw quite a few fatalities, and if I start diving into numbers, I'll go down a rabbit hole, but it was pretty dramatic in that sense.
So, you know, both of us really wandered into public health as a result of a community-led, organic, informal needs assessment happening on the ground where our communities were showing us that the needs of people who use drugs were not being addressed by the systems in place. And White Earth has engaged in some really innovative programming to fill these needs. Can you just talk about that a little bit?
Absolutely. I'm fortunate that I sit in the seat today as the Director of Behavioral Health. I have just a little over 400 employees. We have 12 departments. We're throughout the state. When I first started in this work, it was through a volunteer process with my sister, who was doing some work around domestic and sexual violence. And one of the tasks that she assigned me was to talk about HIV and sexual assault, and I never saw that connection, right? So I really started there, and we started diving in, and we saw that intersectionality, and this was almost 2 decades ago. We saw the number of women that we were working with start the HIV rates, the number that were involved in overdoses themselves. The movement that we were working towards really was led by our women for that reason, the survival of our people. And in fact, when we were doing some of our early work around overdose, I'll always remember the community we were in when one of the women from the community said, "There are no more men left in our family. I have lost all my children to either overdose, and the one surviving male is incarcerated for the rest of his life." And in our traditional way, that's how our clan systems are passed down, and we saw that loss happening like that. We also saw, you know, the Super Bowl Sunday that, you know, the nation was talking about, Philip Seymour Hoffman. His passing caught everybody in the country by surprise. We were having dope talks in our community because we were burying 3 members that weekend. You know, we saw that disconnect and this continued fight. And a lot of it it's individuals caught in those intersections. And I think that's truly the biggest issue we continue to face.
Absolutely. And you know, some of the things that I find so exciting about the work that White Earth is doing is the weaving of traditional Ojibwe healing methodologies with evidence-based strategies.
Yeah, that's truly, like I said, I sit in this amazing seat. You know, in the last 10 years, we've seen a lot of innovation in White Earth where we've taken the cultural foundation, traditional healing, you know, our cedar ceremonies, things like that, and our programs are based off that. But then we've got that network, or that framework of CMS regulation, because we are a 638 tribe where we have contracted to take on delivery of healthcare systems for our people. which is really the job that I continue to do today, is how do we continue to honor our tradition, the cultural wisdom that has been passed on for millennia, from time immemorial, right? How do we build programs authentically around that, but then make sure that we have that affinity to the CMS structure and things that we need to continue to allow it to be billable.
And one of the problems that we deal with as tribes is that in order to bill CMS for services and maintain sustainability, we have to operate within state Medicaid plans that are absolutely not set up to work with tribes. And in Wisconsin, what we're seeing is that we cannot bill for peer support services, which is so needed. I mean, you have 40 peer support service people that are billing at the Medicaid encounter rate, providing jobs in the community, and real sustainability. But in our tribe, we're unable to do that because Wisconsin has a completely different Medicaid plan, even though we maintain tribal sovereignty. So these kinds of things are really challenges that we have to deal with still. I'm gonna, in our last kind of wrap up, I'm gonna ask about some inequities. So both White Earth, Bad River, a lot of other tribes are operating syringe programs now in the United States. We have to maintain low barrier services, and so we're not asking for identity. And this means as tribes, we're servicing our whole community. We service the settler population and tribal people because the traditional public health systems are not. But yet, we are not receiving resources and support from the states or the federal government for these essential services.
Yeah, I think that's the problematic side of what we do. You're on the Wisconsin side. Arguably we share a lot of treaty territory. Our people travel together. We know that long bound history. But that is problematic when we see the disparities that exist in the way that states work with tribes. And we've talked about this for the last couple of years, where we see real stark differences. To me, it comes down to that respect of tribal sovereignty. And Minnesota is really good at that, but we still see at the federal level some of that pushback when we talk about the irony of traditional healers being reimbursed at reimbursement rates, things like that, right? Where in Minnesota we're pretty progressive. We have that support of our Department of Human Services, those that do the state plan amendments. We see the opportunity for us to really take on the full what was the intent behind self-determination, Public Law 93-638. We have that support, we can do it. You cross that imaginary line and you have that structure.
Totally different. Totally different situation. Yep. And so if we don't have the buy-in from the state, our services are limited. And with limited services, it means that we're seeing really bad outcomes on the ground. Absolutely.
And that to me is the irony, right? I think we talk about historical trauma, we talk about people using drugs for good reasons, we talk about complex trauma and that historical. We may not have been in boarding school, but I know the way my grandmother related to me was because she was in boarding school. She would hesitate to say anything in her traditional language because she would pause and she would kind of wait for that hit because she remembered she would get hit, right? And so I think that's what we got to continually fight for is the loss that we've experienced is manifesting in our today's world in loss of life. And so, to me, it's going back to our culture. It's going back to traditional language. The things that were literally taken from us, beat out of us, killed our people for, stole our land for, and yet we're still fighting that fight to say that our traditional ways are evidence-based. And so,
and when we talk about harm reduction, this idea that, like Sam was talking about, our people who are using drugs deserve respect and care and compassion. That is absolutely consistent with our traditional culture and our traditional values. In the few minutes or less than a minute that we have to wrap up, I'm wondering if you can just take out your magic wand. What are some policy changes? What are some world changes that you'd like to see to turn around these trends?
I would argue two things. One is the decriminalization. I think we need to hit that. It's a no-brainer. And the second, I would say for American Indian people, it's in the United States, Article 6 of the U.S. Constitution, it's already there. treaties are supreme law of the land. We need to honor the treaties. It's respecting our connection to land. It's honoring those things. And I think we would be doing a lot better.
Absolutely. Well, thank you for this conversation.
Thank you.
Miigwech.
Thank you. This is awesome.
Miigwech, you guys.